An adverse health event is usually a result of a medical error, substandard care, a known side effect, or an unexpected complication. The report was released today by the Minnesota Department of Health. ABC 6 News reporter Alex Cotter breaks down those numbers for us, including results from Mayo Clinic. Alex.
Laura, in 2021, the Minnesota Department of Health says an uptick of 126 incidences happened at Minnesota hospitals, including here at Mayo Clinic in Rochester. Those numbers coming at the height of the COVID-19 pandemic. Across Minnesota in 2020, there were 382 reports of accidents or incidents that resulted in a patient being harmed. But according to the state, that number leaped to 508 in 2021. Rochester's Mayo Clinic, responsible for 73 of those incidents last year, compared to 58 in 2020 and 53 in 2019. The State Department of Health reporting pressure ulcers and falls accounted for over half the incidents across the state. But Mayo Clinic's results were a little different.
Pressure injuries for us actually decreased. For the reporting year for 2020 and 2021, we had 21 compared to 27 the previous year. However, falls did increase for us. Falls went up to 22 compared to 15 the previous reporting year.
I spoke with some nurses in Rochester who didn't want to go on camera, but said short staffing due to the pandemic weighed heavily on them and caused a lot of fatigue, which can lead to mistakes. Dr. Ramar saying the healthcare provider is making it a priority to address these statistics by investing more in technology to help prevent these kinds of issues in the future.
Particularly when you have issues with workforce shortage, if there's a way we could leverage technology to automate that process, that's going to give time back to that nurse to be able to take care of the patient.
Mayo Clinic has also started using artificial intelligence and advanced analytics to help educate staff in order to prevent patient injury.
And that's in the process of being implemented here, which will hopefully mitigate some of these issues that we're continuing to have with pressure injuries. We are starting to look at predictive modeling for falls as well.
Now, I also got the chance to talk to some of the patients here at Mayo Clinic along with their families, and they said that they haven't experienced any of these problems and that this is the best medical care they've ever received. Live at Peace Plaza in downtown Rochester, Alex Cotter, ABC 6 News.